video here, I want to take you through some general stretches for those that might be suffering a little bit of lower back discomfort. It's not designed if you have like a specific injury and then you're working around that. It's very generalized. So I'm going to take you through some stretches and some mobility exercises that will roughly take you, if you do them all, if you do all of them for the length of time that I recommend, it could take 20 or even 30 minutes if you throw some foam rolling in at the end. I'm not going to do the whole thing with you, as in I'm not going to hold each exercise for a minute. I'll show you the exercise and then you'll be able to hold for a minute. An idea is to pause it and then carry on after your minute. Alright, so all you'll need is, generally it's just going to be your body, but a towel or a band like this will help for some of the exercises. So to get started, you'll lie on your back, on a mat or just on the ground, doesn't really matter. Bring your feet in close to your hips, and then from there you're just going to roll your knees side to side like this. So you do 10 rotations side to side. Try and relax with it, don't force any range of motion. After 10, walk your feet away just a little bit, and then you're going to do 10 more rotations again. So your feet and knees are pretty close to each other as you just rock it side to side. You're not forcing the range of motion, walk out a little bit further again, through the knees, but it's coming from the hips. After this, all you're going to do is you're just going to bring your right ankle up to your just above your left knee, and I just want you to lie back and I just want you to hold this stretch here. And all you can do is you're just going to hold this stretch here for 1 minute. So you put a timer on and you hold there for a minute. You should be feeling this down the right part of your hip. You can push your right knee forward that way to help intensify the stretch as well, or you can pull the left knee towards you. After a minute, you would switch sides. Really important you do hold it for a minute. If you're finding this quite a tough position to get into, you can lie yourself in front of the wall, and where my right foot is now, that would be pushing against the wall, and then you just lie back in that position there, and you'd hold for the 60 seconds, making sure with all our stretches that you're breathing through the nose, in and out through your nose, and it's nice and slow and relaxed breathing. We want to try to get out of the fight or flight mode and into this more relaxed parasympathetic nervous system. And so after we've held it here for 60 seconds, then what we're going to do is you're going to take your right knee and you're going to pull your right knee very gently straight in towards your chest, and you're going to hold that position there for 30 seconds. After your 30 seconds, I want you to just angle your knee out to the side a little bit, and you'll find that for most people you'll come out to the side and then there'll be a point where it can just go a little bit back further towards that right shoulder. And then you're going to hold that for 30 seconds as well. After 30 seconds, then we'll switch sides. So left knee will come in towards the left shoulder, hold for 30 seconds, then we angle it out to the side, and you hold that position there for 30 seconds as well. Okay, after about 30 seconds per side there, then we're going to go into our banded hamstring stretch. So if you don't have a band, that's okay, you can just grab that, or if you've got a towel, that's good. But see, it does definitely work better if you can bring a band or a towel around the forefoot here and just lie back, and then keeping this leg straight and flat, you're going to start bringing your left leg in towards you. And then from here, we're going to switch it up to the other side. So bring the band onto the forefoot, and then once again relaxing into it, holding for 60 seconds at just a very mild intensity. Once again, it's a 4 or 5 out of 10 discomfort range. We don't want to ramp it up to 8 or 9 where it's really excruciatingly painful and uncomfortable. Okay, after we've done that, the last one in this position here, this can be for some people just impossible to get into, but for some people they get a lot of relief from it. So you can either do this half happy, it's called a happy baby, a half happy baby, or a full, where you grab the instep of your foot and then you bring your legs out to the side and you just drop down into this position here. And then once again you relax down to that position. If that position is just impossible for you to get into, then don't worry about it. You can feel free to skip that one. Then we're going to go more into our movement, so our mobility drills. We're going to go into our first one, which is a cat-camel. And then from here, we're going to start in just past the neutral position actually, and then you're going to tuck your pelvis under, and then you're going to lift all the way up to that top position, bring your chin to your chest, and then we lift the head, drop between the shoulder blades and all the way back down to the tailbone. So tuck the tailbone under, start lifting up through the spine all the way into the upper back, chin tucks on the chest, take a breath in, and then exhale, dropping back to that start position, and you do 5 reps of those. After that, you're going to take your right leg and you're going to come behind your body here, slide it down along the ground and reach forward with the right arm as well. Hold for a 2 count at the bottom and then come up to the top. Then we go to the other side. We're going to go down, all the way down, hold for a 2 count and then come up. So as you go down with my right leg moving, I'll feel it through my left hip, and then as I reach forward with my right arm, I'm going to feel it all the way through the right side of my torso. And you do a total of 10, so 5 per side of these here. That's it, so you continue through and you do 10 reps of those. Then from this position, whilst we're here, you're just going to lie on your front, and everyone's hands position are going to vary for this. If you're very tight and uncomfortable through your lower back, bring your hands forward as you push your chest up off the ground. If it's not so uncomfortable and you've got good range of motion, good flexibility, then you can bring your hands in closer and closer. Once again, you're not forcing anything, and if this creates pain and discomfort for you, then we don't do it. Because there may be something going on with the disc, and if the disc is in such a position that it's kind of to the forward of your spinal column, then this will give a lot of grief. Alright, but for the rest of you, it should be okay. And then you just do 10 reps, and then the last one, you're just going to hold for a 10 count. Okay. Good, then we come up out of that position. Sometimes it's nice just to rock back. And then we come forward into our hip flexor stretch. From here, actually I've changed the legs. From this position here, what we want to do is we're going to hold a stretch through the hip flexor. By engaging your glutes here, you're going to squeeze through your pelvis, so your pelvis, squeeze through the glutes so your pelvis rocks under, and then that lengthens the front of your hip here, in your hip flexor, and you're going to hold that position. That's a far better way to do it than just drifting into it this way. So here we get glute activation and hold that stretch while you stay nice and tall. Same as the others, 60-second hold, and then we move on. So then we switch sides, 60 seconds here, same thing, glute activation, engaging. When the 60 seconds is up, you're going to bring your hands down onto the ground, and all you're going to do is you're just going to rock your weight back and forth here. So you're going to go for 5 reps there, and these are the hamstring pulses, so we're getting into the hamstring here. After 5, then what I'll get you to do is you're just going to come up. You can do that 5 times as well. Four, and one more, 5, and then you'll switch sides and you do the same thing. Alright, so you'll be here and you're just going to rock back and forth 5 times, and then you're going to go up and down 5 times as well. Good. From this position, then I'll get you to lie on your side. You're going to bring your knees up in line with your hips, and then your ankles directly under your knees. Bottom hand's going to support your head. Then you're going to circle around this way, following your hand with your eyes, and then come straight back across when you get to horizontal. So circle, 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 trying to keep your hand on the ground. Once it gets to horizontal, come right back across. So we circle around, then we're here, and straight back across. For this half kneeling QL stretch up through here and up through the side of your torso, it's good to be able to use some sort of a frame to do so, because what we're going to do is you're going to place your right knee down and the right hand's on the bottom, come across with your left side, and then from here you're going to lean in, so really opening up through here, opening up, and then you're going to take long deep breaths through your nose. Actually, I exhale through my mouth. It should all be through your nose. And then when I'm thinking about my breath, I'm trying to breathe to the outside, right into the ribs. And then you do the other side. Okay, so then we go this way, and you'd hold for a minute again. Big, deep, long, slow breaths. Using the same frame, what you're then going to do is you're going to grab with your right hand, and then from there, you're just going to sit back into it as much as you can. So really sit back, showing the left side, sit back so you feel this part, so the shoulder joint actually opens up, and we get a big stretch into the lats here, and we create what's called traction. So we're going to create some traction, and then with my right arm, I'm just going to turn, I'm going to bring it under this way, and then come up. I'm going to relax off, get that traction, and turn underneath. And let's do one more time. Here, get the traction, and then turn. And then obviously you're going to go along to the other side. So right side here, sit back into it as much as you can, and then turn as you come through. Here, sit back into it, come right through, and then one more. Like so. So after we're done with our lat stretch, then all I want you to do is just lean over and roll yourself forward into a toe touch. So you'll be from here, and I just want you to slowly roll yourself over as much as you can, roll yourself down as far as you can. If you're touching the ground, that's great, keep it going. Couple breaths, and then I want you to walk your hands back up your knees again. And just do that 2 more times, so then you roll. And then what we've done is we're opening up that spine a little bit more. And then for the last exercise, what you can do is you can just take just your normal squat width stance, and then you can come down and you can sit down into the squat position, and you can sit down in here. Okay, for some people it might be too hard, and that's okay, you just skip this exercise, but some people might find it really nice. And then you're just going to rock side to side. So I've got my elbows pushing out into my knees, and then I'm just going to twist side to side. Really focus on relaxing through the belly as I sit in here, and take those deep breaths again. It doesn't really matter how long you do this. You can do it 30 seconds or a minute or 15 seconds. Come back up and then go again. Right, so that's our main routine. You can then put in some foam rolling exercises that we can talk you through as well. The key thing with foam rolling is that a lot of people don't spend enough time in that one position. So you do, if you say you're working this area here of the thigh, you do want to spend about a minute on those really tender points. And the other side of it is it shouldn't be too tender. If you're finding it's excruciatingly painful, it's like a 7, 8, 9, 10 out of 10 in pain, then you need to be able to just regress it a little bit, take a little bit of load off, so it's only that 5 out of 10 is really what we're going for. We don't want this negative feedback loop that you get when you've got too much pain going through. So that's it, there you have it. Should take 20 or 30 minutes, take it nice and slow, don't rush it, give it a go, and hopefully it helps reduce some of this lower back discomfort that you might be having.